Have you ever experienced severe stomach cramps, fever, and diarrhea that just won't quit? You might be dealing with something more serious than a typical stomach bug. Today, we're diving deep into Shigella, a common but often misunderstood infection that can cause significant discomfort and health risks. Shigella is a highly contagious bowel infection. It's caused by a group of bacteria known as Shigella, which primarily target your digestive system. This infection can lead to severe diarrhea and other unpleasant symptoms. These tiny bacteria are most commonly found in feces, or poo. The infection usually spreads through contaminated food or water. Anyone can contract Shigella, but it's particularly prevalent among young children. It's crucial to understand that Shigella can also be transmitted through sexual contact. This often happens when there's contact with fecal matter during intimate activities. Knowing these transmission routes is the first step to prevention. Most people infected with Shigella experience mild symptoms that resolve within a few days. However, it's important to know what to look for, as some cases can be more severe. Symptoms typically appear 1 to 3 days after exposure. The hallmark symptom is watery diarrhea, which can sometimes contain blood, mucus, or pus in more serious instances. You might also feel nauseous or experience vomiting. Abdominal pain and cramping are very common. A high temperature, or fever, over 38 degrees Celsius (100.4 degrees Fahrenheit) is another frequent indicator. Some individuals even report feeling generally unwell or depressed. These symptoms can last for up to a week, making daily life challenging. While many cases resolve on their own, knowing when to contact a healthcare professional is vital. Don't hesitate to reach out if you suspect you have Shigella symptoms. Early intervention can prevent complications. Contact your GP practice if you experience any symptoms of Shigella. It's especially important to seek medical attention if your diarrhea contains blood. Always trust your instincts. If you're worried about your symptoms, get them checked. If you suspect the infection was passed on during sex, contact your local sexual health service. They can provide specialized advice and support. Open communication with healthcare providers is key to proper diagnosis and treatment. When you visit your GP or nurse, they will start by discussing your symptoms in detail. They'll also ask about your recent travel history, as Shigella is more common in certain regions. Be prepared to share this information openly. It's also important to inform your doctor if you believe the infection was sexually transmitted. This information helps them provide the most accurate diagnosis and appropriate care. Don't feel embarrassed to discuss these details. To confirm a Shigella infection, further tests are often recommended. These tests involve sending a sample to a laboratory for analysis. This ensures an accurate diagnosis and guides treatment decisions. There are 2 primary ways samples are collected for testing. A stool, poo, sample is the most common method. Alternatively, a swab may be used, where a small cotton bud is gently wiped over the potentially infected area, such as inside the anus. In many cases, a Shigella infection will clear up on its own without specific medical treatment. Your body's immune system is often capable of fighting off the bacteria. Rest and hydration are usually the best course of action. However, if your symptoms are severe, or if they persist for longer than 1 week, your GP may decide to prescribe antibiotics. Antibiotics can help shorten the duration of the illness and reduce the risk of spreading the infection. Always complete the full course of antibiotics as prescribed. It's important not to self-medicate with antibiotics, as this can lead to antibiotic resistance. Always consult a healthcare professional for guidance. They will determine the most appropriate treatment plan based on your specific condition. Shigella is highly contagious and primarily spreads from person to person due to poor hygiene practices. For example, not washing your hands thoroughly after using the toilet is a common way the bacteria can spread. This highlights the importance of diligent hand hygiene. In many communities, Shigella infections are often passed within families or in settings where people are in close contact, such as schools and nurseries. Children are particularly susceptible due to their developing immune systems and close interactions. Contaminated food is a major source of outbreaks. Beyond these common routes, Shigella can also be passed on sexually. Any sexual activity that involves contact with feces can transmit the bacteria. This includes practices like anal sex, or oral sex that involves licking the anus, often called rimming. Other risky activities include fisting, or touching a condom or sex toy that has been used for anal sex. Having oral sex after anal sex without proper hygiene can also facilitate transmission. Men who have sex with men, MSM, may be at a higher risk due to certain sexual practices. Preventing Shigella infection is largely about practicing good hygiene and being mindful of potential transmission routes. Simple steps can make a big difference in protecting yourself and others. Let's look at what you should do and what you should avoid. Do always wash your hands regularly and thoroughly. This is especially important before preparing food and after using the toilet. Use soap and water, and scrub for at least 20 seconds. Wash your hands after sex, particularly if you've touched someone's anus or handled used condoms or sex toys. This helps remove any potential bacteria. Maintaining good personal hygiene is paramount. For anal sex, always use condoms. Condoms create a barrier that significantly reduces the risk of transmitting infections. For rimming, use dental dams to prevent direct contact. These barriers are effective protective measures. If you have symptoms, do not prepare or serve food for others until you have been symptom-free for 48 hours. This prevents further spread through food contamination. Your recovery is important for public health. Avoid using swimming pools, hot tubs, or water parks until 48 hours after your symptoms have completely stopped. These environments can easily become contaminated and spread the infection to others. Be considerate of public health. Do not attend school, work, or other group activities until 48 hours after your symptoms have stopped. This helps contain the spread within communities. Prioritize your health and the health of those around you. Finally, avoid drinking tap water in countries with poor sanitation systems. Stick to bottled water or water that has been properly treated. This reduces your risk of exposure to various waterborne pathogens, including Shigella. Understanding Shigella is the first step to protecting yourself and your community. By recognizing symptoms, knowing when to seek help, and practicing diligent hygiene, you can significantly reduce your risk. Don't let this common infection catch you off guard. If you suspect you have Shigella, contact your GP or local sexual health service immediately. Share this vital information with your friends and family to help spread awareness. Together, we can prevent the spread of Shigella and ensure healthier communities. Stay informed, stay safe, and prioritize your well-being.